Good evening, everyone. A warm welcome to this Saturday evening at 7:30 p.m. Now we are with Raghavan sir. So let us give Raghavan sir a warm welcome from each and every one of us. So Raghavan sir, a warm welcome to you, and good evening, friends. Thank you, sir. Carry on, sir.
Okay. I just took up this topic of cancer. Able to hear me?
Very much, sir.
Okay. Because just met a patient about 4-5 days back, and she was terribly worried. She underwent a hysterectomy, and then they said that you have chances of these cancer cells lodging somewhere in your system, and you have to go through chemotherapy. And I'm totally against chemotherapy. Totally against chemotherapy. Because chemotherapy, it not only kills the cancer cells. How can it identify only the cancers? It also kills normal cells. The whole body becomes weak, loss of hair, loss of so many things, vomiting. The entire system goes for a 6. And some people, they do survive. And some people go, they pass away. So then I thought, why not we bring in an awareness? As far as I know, I'm not a oncologist, where I am a specialist in cancer. As far as I have viewed it from the acupuncture therapy point of view, I thought, okay, let me throw some light into this cancer. Because people are dreaded what they say. Once you get cancer, that is the end of it. Actually, I tell you, I treated a patient way back in 2009-10. He had a blood cancer. And they're terribly scared. And I treated him. And today, he's still alive, hale and healthy. He's in Philippines, doing very well. Just hardly 2 months treatment only. He had blood cancer. So from that time onwards, I thought, after that, no cancer patient came to me. But still, I have a very good, what you call, a firm belief that cancer is not something not curable. Cancer is cancer. So no one need to fear that once you are identified with cancer, then that is the end of life. First radiation, that is surgery, etc. Till the cells they go, cancer cells they go and sit somewhere, then again it will proliferate and you will have problems. Not necessary. Not you know how to handle the entire your body, to handle yourself. identified with cancer, don't fear. First thing is fear. What if the cancer has set in? So I might die. No, not I had an aunt of mine. I am talking about 40 years. He was identified with cancer, and that was removed also. And he died only at have to definitely, you have to definitely keep your cells, your every cell is individual cell. It is God's brain. But keep them happy. Once the cells, you are happy, then the positive vibrations, they will drive away any of the disease. Don't fear. See, after all, think all of us are going to die one day. Some reason, some disease, something has to be a reason for you to die. We are not Shashvatam. We are not going to be there all the time. Okay. So first thing is live happily. Live happily and die. So that you will not undergo the problem. Because once you become negative, okay, then the disease spreads and the agony is too much. Agony is too much. Don't worry about all that. Stay happy. First thing, you should not feel. You should not feel, I have this disease, I have this problem. So what? So what? So nothing. Anybody, see, where you tell me a person who is not having problems. Everybody will have. Being born as a human, you will definitely have problems. So don't think about the problem. Think about how to live happy. How to live happy. Let it happen. Well, there are people, they don't have eyes, they don't have ears, they can't hear, don't have a leg, don't have this thing. Are they not happy? Still they could pull along in life. Still they do something or other. So not having something you should not put you in sadness. No sadness, nothing. So let us first look into how cancer is found. I don't know whether you have are you able to see my screen?
Yes, sir. Yes.
You are able to, no? Okay, you are able to. Yeah. Hello.
No, sir.
Huh?
What happened, sir?
Are you able to see the screen?
No, sir.
No. Somebody
No,
said
no,
yes.
sir.
No screen sharing.
No screen sharing. What is that issue there?
Yes, sir.
How you are
Yes,
able
now.
to see? Now?
Yes, sir. Waste elimination.
Yeah. Yes. This is how the waste start developing in your body. What's the sign of waste elimination? Type. You don't type. You exhale. You breathe out. You eliminate. Eliminate. whatever breathing in is assimilate.
Sir, sound is not
See,
clear,
your
sir.
voice is not clear.
Low voice.
Voice is not.
Not clear.
It is disturbing, sir. Breaking voice.
How is it? How is it now? Is it okay?
Yes, sir, it's fine.
Fine.
Yes, sir.
So when what you exhale, yes, you are eliminating. What you inhale, you are assimilating. That is, whenever there is assimilation, okay, there is no elimination. Even though breathing looks like one action, it is two. That is assimilation and elimination. Both of them will not happen together. When assimilation is there is no elimination. When elimination is there is no assimilation. So what happens? The waste which is going out normally, it gets thickened, gets dense. The air becomes dense becomes slightly moist because it is compressed. Because normal breathing is not going out. So water molecules. So what happens? You sneeze. You sneeze. That is how the first elimination happens. You sneeze. So once the waste is more, the child goes on sneezing. Then immediately what you do? You allow the sneeze and put some what do you call menthol or something like that, and then you give a lot of antihistamines, food wise, pepper or whatever it is. There's home remedies are there. But what we do, once the sneezing goes up, we take the child to the doctor. So doctor, what does he do? So he suppresses the elimination. The waste which was moist, it becomes a thin phlegm. Thin phlegm. So it starts coming out. Again, you give medicines, then it becomes thick phlegm. Then it becomes slightly viscous, hardened. But the body is always trying to eliminate the waste. So cough sets in. Cough. Then, okay, cough, okay, you put some glycodine or whatever it is, some cough syrups, that is, suppress the elimination. Then it becomes a solid. Again, the body wants to eliminate it. So what it does, it develops fever. It is hard. It has to be melted because waste is air, water, and solid. So you develop fever. The body is trying to eliminate that. But you don't allow that. You put some paracetamol, this, bring down the fever. Then that same waste gets converted and infection sets in. Generally, we feel infection is from outside. No, it is not from outside. It is from within the body. So the microbes are developed from the waste. From the waste, like how you put sugar, immediately the ants come. If there is no sugar, no ant. Okay, it's a waste. So that infection has come in to eat the waste. Once the waste is eaten, then the infection is gone. But what we do, we take antibiotics. Not only kills this bacteria or virus or whatever it is, it also kills some of the bacteria which they do good to us. Then the body says, "Arey, I have to do something. I have to do something to eliminate this waste." So what does it do? It forms a tumor. So what is a tumor? Tumor is, it collects all that waste, all those toxins, and then it gives an extra space in the body. Collect all that, and then what happens is it forms a ring around it. Forms a ring around it, so that it will act on the toxin and then either digest it or break open and throw it out in the form of a pus or whatever it is it wants to throw out. So during that process, you have something called centrioles and Golgi apparatus, which controls the cell division. So the body sees to that the cell division is not controlled. It has to provide an extra space, though the cell division is relaxed. It's relaxed. So more number of cells have to be produced. That is why the tumor is there. It is an extra this. So, but it forms a ring around it so that it is only a one-way traffic. Only the toxins will come inside, and this won't go. And once the entire thing is normalized, or it is once it is normalized, then that ring will be dissolved. But what you do? Edema. So the medicine what you give, it breaks that ring. Though the cells which has been designed to be uncontrollable in cell division, that starts multiplying. That starts multiplying. That is cancer. That is cancer. So we are only allowing it to do so because we are not with nature. We are not with nature. And this uncontrollable, it is all deformed. They'll be different. They won't be like a normal cell. And their entire DNA structure is changed. It produces toxins. It blocks the pathway. And once it starts growing, it grows and it can just escape and gets lodged somewhere, wherever it is. Don't know. That is how it happens. And not only that, constant irritation. So it is a product of cancer is mainly because of product of waste. It's waste. So the best thing is you have to be with nature. You have to be with nature. Don't go away from nature. And the best thing is cancer cells will proliferate in an acidic environment. So you have to stay alkaline. You have to stay alkaline. There are so many types of cancers, so many. Wherever it forms, wherever the cell gets irritated also, especially for women. When you don't follow the procedure of taking rest during your periods, you are supposed to take total rest. But who is taking nowadays? They think, these are all humbug. Why we should do that? Those days, they will be separated out. They will be asked to sit, not to take bath during those days. And they will eat very less. Why they are doing that? Why they say they are not supposed to take bath? See, any cell which is live within you, but it has lost its function or damaged, will be thrown out with blood only. Suppose you get an injury, small amount of blood is lost because only that many cells have been damaged. So with blood it is thrown out. Bigger injury, more blood loss. Likewise, the egg which is awaiting for fertilization doesn't get fertilized. The 27-day cycle doesn't get fertilized. It is thrown out. It is thrown out. So when it is thrown out with blood. That is, an elimination process is happening. So when an elimination process is happening, body gets heated up. So that is why they say don't take bath. Okay. Number 2, you are not supposed to exercise because you know the 3 forms of energy. One is your digestive energy, then you have the locomotive energy, then you have the immune energy. So immune energy is the one which helps in elimination. So it requires both digestive and locomotion. That's why you are asked to sit. You are not asked to exert yourself. So that the immune energy gets, and eat less, immune energy gets from digestive energy as well as from locomotive energy, more energy, so that the elimination is complete. Elimination is complete. So you are supposed to take rest. Look at the advertisements today. They say you wear a pad or whatever it is, then you can play tennis, you can jump over the wall, you can do all that, you can be normal. Stupid. Absolutely stupid. Why do you have to take rest? I don't say that you sit in a corner and all. You understand this concept and you take rest. You take a lot of rest. Only then the entire waste gets eliminated. Nobody cares. That is why this waste is getting accumulated. Then it becomes a tumor, then it becomes cancer. That is why the incidence of cancer is becoming more and more, because you are not allowing proper elimination. You are not at all allowing proper elimination. That's why this is happening. You have to be very careful, very careful. Just take 3 days off. No problem. No, what will I do? No, I have to go to work, I have to go there, I have to go this. You are being born as a lady. That is why those days the ladies were not going for work and all. They were taking care at home. They're really taking care at home, taking care of the children. People now they are weaker sex, and that is why this is happening. Women's liberation. I don't know, because these are all things which have happened. Okay, even now, at these present circumstances, keep this in mind. Keep this in mind. Now there's a cervical cancer, this cancer. They take out pap smear, you have to take, you have to look for so many things. But if you practice all these things properly, then this is not necessary. At least you educate your children. Educate the children. You tell them this is what it is, this is why it is happening. You have to take rest. Don't exert yourself. But I don't know. You think, this is what do you say? That is, women are being suppressed. They are not allowed to do this. That's why they said, because they brought in this strict formula. It is only for your health, not that they want to rule over you and to thumb you down. Nothing like that. Nothing like that. You should understand why this ritual, why most of the rituals or most of the things, they are all scientific, absolutely scientific. Whatever the elders said, they are all correct. All correct. Those days, please rest yourself completely. Eat less. Don't take a bath. Only you can swipe. Don't take it because heat is required. Heat is required for elimination. My mother and all, they used to follow this very strictly. Very strictly. So we used to ask her what to cook, how to cook, and all. She used to sit there. But they never exerted. Till she died. She died at the age of 92, but never had any uterus problems. Nothing. She produced 3 children. So this is what it is. That is, you have to really follow this. You have to give rest. You have to give rest. That is why all these problems come. All these problems. Okay. Please follow this. Then you have, because the cancer, the DNA, that gets irritated. The constant, suppose people are smoking. Smoking not only gives lung cancer, but there is a toxin which goes on irritating the cell. Mouth, cancer in the mouth. As you chew tobacco. This poison goes on irritating the cell. That's why you get mouth cancer. Okay. And even then, how to identify? Suppose even women, suppose you have got, how to know that you have got cancer? Cancer in the uterus, cancer in the vagina. How does it happen? First thing is, even when you don't have periods, there will be blood will come. You might have drops or whatever it is. That shows that, right, that means it is eliminating, because body, it has got a self-defense. So it will try to, because once the cancerous cells are formed, it will try to throw it out. That is why first thing is blood coming. For some people, when they urinate, blood comes. When they pass motion, blood will come. Passing motion, blood is coming means, that means you have to check your colon, whether there is any cancer in the colon, cancer in the intestine. Possible. This. So you can check that, because now colonoscopy and all the other things are there. You can do that. Then you can check it. And what are the other symptoms? Generally, what happens? You start losing weight. Suddenly, for no reason, you start losing weight. Because assimilation is not happening. Only elimination is happening. Then what happens? The hunger or frequent urination, frequent motion, because body is trying to eliminate to save you from the cancer cells. But we continue to keep ourselves acidic, and we don't bother about eating healthy food, eating all junk. All these things will lead to that. All this. You have to really eat. So what is happening? Why your immunity comes down? Why your immunity? So first of all, you have to understand what is immunity. Immunity means, there is a constant burning of oxygen in your cells by mitochondria. So constant burning is there. So at that time, the O2, oxygen O2, it is split into 2 O's. Okay. So one is utilized for synthesis. The other one is free. That is called free radical. It is called free radical. So, but that has to be captured. It has to be captured. So your body is producing antioxidants. That is glutathione. That is formed antioxidants. So that will go and capture that free oxygen and make it inactive. Otherwise, it will go and sit on an enzyme. it goes and sitting on an enzyme, then what happens? The enzyme's quality, it becomes different. Suppose your product has to be turned from A to B by an enzyme. That enzyme is not there, A starts accumulating. So that becomes a waste. Okay, that is how waste is developing in your system. So these antioxidants are very, very, very important. So, and it works mainly in an alkaline environment. So somebody was saying, because I saw some video, they say cancer patient, they are in an alkaline environment, they will become good. These are all rubbish. Acidic, how do you say? Your stomach is acidic, your blood is something different, but that is not. Body has got different pHs, but actually the cell pH, actually what is happening in the cell, all the biochemical changes or everything happening in the cell only. I'm not talking about acid production or whatever is in the body. It is in the cell only it is happening. That is where the assimilation is happening and elimination is happening. So if you don't have the proper alkaline environment, then whatever is being manufactured becomes a waste. Becomes a waste. That is why we say take alkaline food. Take alkaline. It is about 7.2 or 7.4 the cell's pH. That becomes very important. Becomes very important to maintain. But we consume so much of acidic food. So what is the best source? Why they say eat green? Because green means there is chlorophyll. Green means chlorophyll. What is the core of chlorophyll? Is magnesium. Magnesium is alkaline. Magnesium is the most wanted chemical in your system. Some people suggest you can take magnesium sulfate, itself chloride, if you have cancer, or morning drink you can have. But please consult a doctor, don't take my words, because I have never tried. So that is one thing. You should keep your body. So best thing is green juices. Green. Whatever green leaves, juices you can have. You can have carrot juice. A lot of carrot juice. And the best thing which I have been telling is your seasoned buttermilk. Like 2 liters of seasoned butter. Buttermilk is alkaline, but it should be seasoned. Curd is acidic, but buttermilk is alkaline. Avoid milk products. Why avoid milk products? They contain a lot of amino acids. Amino acid. So avoid milk, but buttermilk you can have. You can have ghee. You can even have butter. They all contain a lot of linoleic acid, which contains again antioxidants, converted to antioxidants. So many things. And selected fruits. Some of the fruits, avocado, it contains glutathione. Avocado you can have. You can think of grapes. You can have wine. Wine. That gives you a lot of antioxidant. That is river tannin or something. It is in grapes. Then you can take vitamin C. Because vitamin C helps in manufacturing antioxidants. Vitamin C you can take. And lime you can take. But don't take tartaric acid, as I've been telling you, but you can take lime. So that is, it makes the body environment very good. Apples you can take cherries, they contain a lot of, you can just go search in Google, what are they say 8 fruits, 7 fruits which you can have for if you have cancer. See, even look at the things, that grapes, it is in a bunch, multiple fruit, like cancer cells, and it is telling you grapes you can have. Okay, grape seed is also very good, and then you can think of sitafal. multiple fruit. Again, it is a multiple. They are all like cancer, this thing. So you should think of such kind of foods and be more on liquid and eat only when you are hungry. Should eat only, but be more on liquids. More on liquid. You can get out of cancer in no time. It is nothing. And the most important thing is keep yourself positive. Positive. Be positive. That nothing will happen because these people were not able to find out a medicine for cancer. They said cancer is incurable. Cancer is curable. Please take it from me. Cancer is curable. Because you will die only on the designated day. But why is they say that you should not undergo any suffering because of cancer. Don't at any time get funked. Never. It is absolutely curable. Absolutely curable. I told you, a fellow, he had blood cancer. I'm talking 2009, 15 years. Still he is alive, kicking around. He is in Philippines, making a lot of money. Why? How come? And what are the points from the Aku paper point of view? Actually, you have SP6 point. SP6. Right opposite, that is, you hold the your leg. SP6 is here. Right opposite onto the other thing. That is GB39. GB39. You just hold it like that. Okay. So the blood is the one which is carrying your all the cells, no? Okay. And the blood cells are manufactured by the bone marrow. There, the whole thing gets neutralized. SP6, and for all the cancer patients, SP6 will be paining. SP6 will be paining. So you just hold on to it and then give them the treatment over there. I tell you, they can come out of it. Because again, it is balance. Again, it is only balance. But at the same time, see to that you are keeping yourself alkaline. Alkaline is the main mantra to get over cancer. Irritation. Irritation of a particular cell, that leads to cancer. That leads to cancer. So I thought, okay, right, I will brief you because people are scared. Why cancer, that, this? Nothing to worry. Nothing to. You can be hale and healthy. Okay. You can be hale and healthy. Don't worry about it at all. Now you can, because you might have a lot of questions. So we can discuss.
I request everyone to raise your hands so that we can unmute you and you can ask for your doubts, please. Cynthia ma'am, you have any doubts? Dev Kumar sir, you have any doubts?
Ujjwala ma'am.
Not able to hear.
Now you can.
Please.
Atmavandan sir. Sir,
Yeah,
Uh, to stay alkaline, we have to consume greens, juices, and greens, any type of greens.
yeah.
So, but those who have vata more,
Hmm.
bodies, body have more vata, so it's not able to consume more greens,
Why not?
because if we take a more greens raw, cook okay, but if we take a more greens raw, then again the gases and the stiffness in the body will increase,
No, no, no. Actually, you just
and the spleen
no,
spleen also will be imbalanced.
no, no, no.
Affecting.
Water? No, no.
Hmm.
You add anything to water. What I suggest is
Hmm.
don't take plain water. You add anything to water, that becomes food. It is not water.
Mhm.
That becomes food. So your water imbalance will not go up. When you take some liquids which is considered as food. But
Mhm.
what I suggested, don't take plain water. You take plain water, yes, what you say is right. Nothing will happen. Your water will not go up. It will be staying, and eat only when you are hungry.
Hmm.
Take a lot of buttermilk. That will it keeps your body alkaline. More and more of alkalinity. And you should eat only when you are hungry. Should not eat when you are not hungry. So if you eat when you are not hungry, then the whole thing is converted to acidic digestion. Everything comes. Hunger is the indication that your cells, they want energy. Okay. When you don't eat at the time, the excess glucose or glycogen which is formed, so that will come and takes care. And the next time when you become hungry, then eat. That is how it is. So it is always allow the things to get eliminated, then you can eat. Okay. No problem.
Nowadays, I'm not feeling hungry. This hungry feeling will not be there. But if I won't eat for the long time, I will feel the weakness. And full day, I will feel weakness only.
No, 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 no. That is what you feel. It's not psychological. If you are not feeling the hunger, that means your body is not wanting food. That's all. Don't eat. Don't eat.
Then why I'm feeling a weakness? Why I'm getting weakness?
Why you are getting weakness means body is trying to throw out. Why are you feeling sleepy? Why do you feel sleepy? Body is getting tired. So body is trying to throw out. So it is weak. That's all. There is nothing. Take 1 or 2. Even if you don't eat for 3 days, nothing will happen. Don't worry. So you stay. Feel the hunger and eat. Always feel the hunger. If that is so slightly, you can take some buttermilk or something when to
So the
satisfy you psychologically. That is all.
body's tiredness. So I will not able to do any work. I have to lie on the bed. Then after taking a rest for some time, I'll be okay.
Yeah, because body is trying to, it is eliminating. So it is tired. It wants you to take rest. That is your locomotive, it is finished. You are going for immune energy. Hunger is not there. It's gone to immune energy. So body is trying to eliminate. That you have so much of waste. Let it go. Let it go. What nothing. You are not going to die because of that. Weakness. No, weakness. Let it be there. Take rest. Take rest. Listen to some good music. Listen to this thing. Little do some puja or the meditation. It's a good chance for you to do that. Don't think, or I have to do this. Somebody is coming to house. Somebody is doing this. How can I lie down like this? Nothing like that. First, you take care of yourself. Take care of yourself. Then you can think about others. That is what most of the ladies they do. They think, he is coming back from office, so I have to get these things done. That is, if I'm going to lie down, what will happen to him? Let him go to a hotel and eat. What is that? What is that?
No,
There is
that
nothing.
is a
No, he's not going to divorce you for that. Nothing.
no. That is a secondary thing, sir. First, you will shout hard. This time you are sleeping, you are lying, you are taking a rest. First, you have to do this and that.
Don't answer back. Best thing is keep quiet. You know about yourself. You have not done anything wrong. You are not able to do it. So you have not done anything wrong. Let him shout. So the hand, if you move on like this, okay, once it will become only when you oppose it, it gives you a sound. But if you go on doing it, how long he will do it? Then he will become tired. Then he will think, okay, this lady is like that only. Then he will keep quiet. This is how you have to tackle. That's why we say always silence. Silence. Silence is the best thing. Don't talk back. Once you talk back, then everything, lot of fight, lot of this thing, that, this thing. Then all the old stories, your father did like that, my mother did like this. All these things will come. Don't give a deaf ear.
Okay,
Care,
sir.
care for yourself. Care for yourself. Don't worry. You lie down. Say, I'm not able to do it. I'm lying down. Okay, so I'm not able to cook. Please
Okay, sir.
go to XYZ hotel and eat. Take it.
Oh,
Take it.
okay, sir. Okay.
You can put it in a nice way, not as rough as I said. Put it in a nice way. Okay. If he
Okay,
really
sir.
loves you, he will pardon you. He will not shout.
So, sir, the brown rice is good, or our white rice only should be consumed?
No. Brown rice is good, everything, but take it in small quantity. Carbohydrates, please take it in small quantities. Rice itself, rice or wheat, take it in small quantity because you are loading your pancreas with insulin. Lot of
Then what we should eat, sir? If we that is
take
only
lot
a
of vegetables. Take lot of vegetables.
Mm-hmm.
Lot of rough veg, sprouts. Okay, all these things are good. Take all that because the so-called staple food is not staple food. It really, that is the one which is really bothering. So suppose you are making greens, take a lot of greens, take a lot of vegetable kuttu or whatever it is. Take that. Okay, take a little bit of this. Put a lot of ghee in it so that it goes into from carbohydrate metabolism, it will go to fat. So that usage of your insulin becomes less. Insulin dependency becomes less. So when you buy burning fat, it will give you more energy. So we say add a lot of ghee. That is very good. Cut down on carbohydrates. That is what they call it paleo diet. Paleo diet is something more of fat, especially your ghee. Okay, ghee, butter, cheese. All these things are very good. It is good for you.
So we should not consume other milk product than the ghee, cheese and buttermilk.
Yeah, ghee, cheese, and buttermilk.
Ghee, cheese, and buttermilk.
Yeah, ghee, cheese, and
okay, sir. Thank you. Thanks a lot, sir.
Okay,
I'm getting much knowledge through you. Thank you. Improving day by day. I am improving my behavior. Thank you, sir.
Okay.
Thank you.
Yeah.
Dev Kumar, sir.
Namaste, sir.
Yeah. Devakumar, sir.
Sir, namaste. We are calling from Bangalore, sir.
Bangalore, Heli.
Yes, sir. Sir, the thing, sir, my auntie is suffering with the tongue cancer, sir. At the base of the tongue,
What's that? End. Okay.
base of the tongue is suffering with the base that tongue cancer, sir.
Tongue cancer.
Suppose if she take that carrot juice and beetroot juice, if anything, she will, but she will get that cough inside. The film is there, no, sir. Too much of the cough is coming from inside, sir.
Cough is
cough.
Yeah.
But the film is coming from the chest, sir.
Yeah.
I think past 20 to 25 days past only we found that she was in cancer, sir.
Cancer. Okay.
Yes, sir. We did not go for the biopsy, but we did that CT scan, everything. A doctor told clearly the lymph nodes also filled with that water, sir.
Which one?
That water also we removed lymph nodes. Here the lymph
Nodes,
nodes, sir.
lymph
Yeah.
nodes, yeah.
Lymph nodes also filled with that water.
Yeah.
We removed that water, and again it's not collected, sir.
Again, it got collected.
Not collected, not collected,
Not collected.
but
Okay.
not collected, sir. But
Okay.
we are giving some that Sri Ram, Jai Ram, Jai Jai Ram, that music also we are playing every day, half an hour to 1 hour.
Hmm.
So many that Sridhanya is there, no, sir. Sridhanya.
Which one?
Millet, sir.
Millets. Yeah.
We are giving millet powder, that ganji.
Ganji. Yeah. Yeah.
Yes, sir. We are giving, we are giving.
Hmm.
But only that, only 2 fruits she can take, sir. Otherwise, all the fruits or vegetables, if she take raw,
Hmm.
raw vegetables, she will get that the cough is coming from inside, sir.
Coffee.
From her.
Okay.
No cough. Cough means
Hmm.
only that white, sir. The film is there, na. Only for releasing that, releasing, sir.
Hmm.
Releasing and continuously coming minimum 1 to 2 hours.
Hmm.
After that, it will not come, sir. Which food is best, sir, for that?
How about, did you try buttermilk?
But we did not try, sir. We did not try buttermilk, sir.
Try buttermilk. So buttermilk is also alkaline. Okay. And the
Alkaline,
juices,
sir.
yeah, juices and all. Okay, because
Pomegranate juice is, if she take pomegranate juice, so it will not generate any that cough, sir.
yeah, pomegranate juice is
Yes,
very good anti-cancer fruit.
yes,
Very
yes,
good.
sir.
You can
Pomegranate we are
also,
giving,
yeah. You can
we
give
are
lot of
giving, sir. Yes,
pomegranate. Or you can
yes.
even give this cherry fruits. Okay,
Cherry
and then
fruit, raw
cherry.
or dry fruit, sir?
So just smash it and give it. If she can eat it raw, fine. Cherry fruits you can give. Give lot of
But she can't
vitamins.
open
Vitamin
mouth, sir.
C.
She can't open mouth. She
Yeah,
can't
through mouth.
open,
Yeah, see, try.
she can't
If she
open
can.
mouth. Liquid only she can open mouth, sir. Little bit
Okay.
only she can open mouth.
Yeah. Try to
Only.
give it.
Before
Try
she
to
was
take
very
it.
good, sir. Yes, sir. Before she was very good. The
Hmm.
past 8 years only that she was having that small that this one, sir. In Canada, ask kaddi pudi is there, no, sir.
Hmm.
That what is that?
Okay, what do you say in Kannada?
It's a kaddi pudi. That
Saddi podi.
kaddi pudi, sir. That
They eat. What is that?
what we are using in cigarettes and all, sir.
Uh-huh.
In village side, that ladies are using, sir, with the, I don't know that word in English. What is that?
Okay.
Tobacco,
Okay.
sir. Tobacco pieces is there, no, sir. The
Tobacco.
small pieces are coming in tobacco pieces.
Uh,
But that she was having past 8 years, sir.
okay.
She was
So it is
maintaining
a.
one process store.
It is.
Yes,
It
sir.
is. It is.
She
It
was
is a.
maintaining.
Yeah. It is a oral
She was
cancer.
maintaining.
Oral cancer.
Yes,
It
sir.
is a oral
Yes,
cancer.
sir. She was
Yeah.
maintaining one process store.
Hmm.
But every day the customers were coming and going. That the business was going good, sir. At that time, she did not drink plenty of water, sir. Suppose if she put some tobacco, that
Yeah.
water will circulate.
Yeah.
So in that mind, they use that only that was that she did not that adike. She did only tobacco powder. She will
Yeah.
put in her mouth.
Okay.
When the water circle is going, then she will be happy. Okay,
Yeah.
the water is there. I can go for drink for water. So in the I am seeing, sir, every time when I going every month, I was seeing. But she's only doing this only. But now she's suffering with that end of the base, sir.
Hmm.
The end of the base, bottom side, base of the
Bottom. Yeah.
tongue, base of the tongue. She
Tongue.
was
Yeah.
getting.
In,
Yes,
almost
yes,
near the throat. Okay.
yes, yes, sir.
That is where the problem is.
So we are doing
What?
past 15 days some meditation. Sir. We also bring her to Basara sir also. He put some methi seed and pepper seed and some
Hmm.
colors also. He put the seeded, sir. So I think 2 to 3% is okay, sir. Now she's getting some little bit active, sir.
You
But we
can
need
try this avarampu. In Tamil we call it. This Keshi
avaram,
avarampu.
avaram. Yes, 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 sir. I
Yeah,
heard that flower
Yeah,
name
yeah.
also. Yes.
What you do is you squeeze it, then you make it, you take a juice out of it, add some water, take it,
Okay,
take a
sir.
juice out of it, and you
Okay,
start
sir.
giving it to her. It might work because it is actually a kind of a de-addiction plant.
Yes, 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 yes,
So it
yes.
contains a lot of
Only
antioxidants.
flower, raw flower, raw flower, sir.
Not only the petals. Take only the petals of the flower,
Raw petals, yes, sir.
raw petals. You
Raw
grind
petals.
it, put some water,
Okay.
grind it, squeeze it, and take the juice, and that you
Okay.
start giving it to her. See how good.
Directly with water, sir.
With make it a juice because she cannot
Okay.
eat, cannot open
yes.
her mouth. Make it into a juice and you start giving it her. Ask her to hold it in her mouth and then eat it.
Okay, sir.
Likewise, you can also give
You need to take
wine.
inside, sir.
Huh? Yeah, let her drink it.
Take. Okay, sir.
And you can
With
also
water
give,
can we give, sir?
yeah, with water. Make it into
With
juice
water.
and give it.
Okay.
And one more thing, you can give her red wine.
Red wine, sir.
Red wine. So red
Okay,
wine
okay.
is also anti-cancerous. Okay, give little quantity.
Okay.
Little quantity of
Okay,
red
sir.
wine.
So that
You
is
can give.
raw one or dried one, sir? Dried wine or
Not raw, dried red wine, which is red wine. Bottle, little bit sold in the liquor shops. Okay.
red wine, sir. Red
Yeah,
wine.
it is made out of grapes. Made out of grapes. Okay, you can give that. You
I
can give
did not,
that.
no. Actually, I thought that may be a fruit. Okay, now I got it, sir.
Fruit,
Now I
yeah,
got
fruit also you can give. But grape juice
Okay,
you can give. Pomegranate
Okay.
juice you can give. Even
Okay.
all multiple fruits you can always give. Not a problem.
Okay, sir.
Okay.
Okay.
Try, let us.
Okay, sir. We will try,
This is
sir.
the problem.
Definitely.
This is the problem of chewing tobacco and that. But
Yes,
anyway,
yes.
they will regret it later once they get this. Not while
Yes, yes.
taking.
Now she is suffering, sir. Now she is suffering and she is like so many words she is speaking. No, I need to leave. Two sons also there, so still not married. I need to marry them. So many. Before when she is having like that, when she is having that tobacco and all, she did not think that.
Yeah.
Now she is, now she
Because
is,
only when it comes they will realize.
they will pray with doctors. You do something. Yeah, I'm ready. So many things. She's mentally she is
Ask her to
playing.
take that off. Ask her to take
Yes,
that off. She will be fine. But mentally you should be strong. If it
yes,
comes,
yes,
let
sir.
it come. What is we have to
Yes,
face
sir.
it.
Yes, sir. We are that Sri Ram, Jai Ram, Jai Jai Ram. I heard that the chant is I recorded that music and daily half an hour, 30 to 45 minutes, I'm playing. Playing. Now she's
Good.
mentally reduced her
Yeah.
mental stress to 50% reduced.
Okay. Okay, sir. Yes. Yes. Next. Urmila Agarwal.
Good evening, sir. Namaste.
Who is this?
Sir, Urmila Agrawal.
Yes, madam. Tell me.
Thank you so much, sir, for all your classes. All are wonderful. Sir,
What is that to be wonderful?
I was treating one lady. She was having a lump on her left breast, at 12 o'clock position. We were not aware of it. And during the treatment, I told them to get a diagnosis. And diagnosis and treatment during the treatment the lump was more than half. It was not coming in the fingers. And when it was diagnosed as a third grade cancer and recurrent. So they did the surgery. They removed that
Yeah.
whole breast.
Mm.
But now I think they will go for chemo. So is there any chance we can treat in Ayurveda for further treatment, or we can do the acupuncture further?
Acupuncture, what is that?
I was
You have
doing
to,
acupuncture
mm,
along with some home remedies.
acupuncture, as I told you, you
Yeah.
can do that SP9 GB39, SP, SP6 GB39. Both you hold it like this. SP9, and then
Okay.
SP6 and GB30. That you can give that treatment. But you
Sir, for any kind of cancer?
yeah, yeah, it's all
Okay.
carried through the blood. So the cancer
Okay.
cells, they are spreading. That means they are going through the blood. So the blood is, it is spleen. So, and then the new blood, whatever is coming out, is from the bone marrow. So that is GB39. Okay. You can try it. That is one thing, as far as I know. And again, keep the body, this in alkaline. With the chemotherapy, see whether the body accepts, because a lot of vomiting will might be there. She might lose her hair. So a lot of inconvenience will be there. Because chemotherapy not only kills the bad cells, it also kills the good cells. So you have to put an alkaline. You have to take a lot of antioxidant fruits. Just search in Google, so you will know the fruits which are helpful in cancer. So all the lot of about 8 fruits or 9 fruits are there. So you can give grapes, apple. You can give avocados. You can. So many of them are. So you can give a lot of vitamin C. You can give, and then you can make the body alkaline. Eat only when she is hungry. So you should not eat on and off. So if you can do that, okay, a little bit of wine you can do, it's good. But if you can do that, we can watch. But with chemotherapy, now it is in stage 3. Chemotherapy, I don't know how much it will help. So, but the entire breast has been removed. So anyway, we'll see. Stage 3 is no this, but this thing. But she can thrive for a woman. She can be better if she stays alkaline. This thing is alkaline. But if you're going in for chemotherapy, I mean, my idea is whether you go in for chemotherapy or not. So this may not much help, but you can. But don't take my word, because you should not feel that Array is not gone for chemotherapy. That is why she passed away. Whatever it is. Don't have that feeling. But if you can, but she will live only for that particular time. That's all. Only thing is we can see to that her suffering is not much. Okay. Not able to hear you.
Hello.
Yeah.
I would like to share one thing. It might help to many people. Before starting my treatment, I had told her to apply the hing water on the belly button and on both the nipples, and spreading around 1 inch. And I started the treatment only after 3 days. After applying the hing, she was having some benefit with the
Okay.
hing only. Yeah. So it may help someone else also.
Yeah.
Applying, applying the hing water on the belly button and nipple, it helps like anything.
What water, please?
Hing water, sir. ST podia.
Asafoetida.
Yeah.
Asafoetida.
Ingua.
Okay.
Yeah.
Yeah.
I have seen many patients very nice results in many critical issues.
Okay.
With this.
Good.
Yeah.
Thank
Yeah.
you for that information. Thank you.
And sir, for one person was asking you something. I didn't understand well South Indian accent, but I think somebody is having throat cancer. My mama, my mama Sasur, my uncle, one of my uncle, he was having throat cancer during the lockdown. When he visited our house, I taught him some points and I suggested him to apply the buckwheat on the sujok correspondence throat point. After that, now he can eat. Earlier, he used to take only the apple water. Now he can eat very well.
Oh, good, good,
Yeah.
good, good that you are sharing some of the treatment methodologies. Good. That is how it is. Yeah. Okay.
Okay. Thank you so much, sir.
Okay. Okay.
All your sessions are very excellent.
Welcome. I am just blabbering something. Okay.
Thank you, sir. Thank
Yeah.
you.
Welcome.
Thank you.
Nana?
Smile evening, sir.
Yes. Yes.
It's
Miss
always
Sabina.
nice listening to you, sir. And I could relate to each and everything which you said today. And I myself being a cancer survivor. So
Good.
yes,
Nice to
I
see that.
fought cancer in 2016. And I was following all these dietary, instructions which you gave today, especially the buttermilk. It really helps when the chemo effects are there. So I am your maybe I vouch for every point which you said today. That all of that works.
Yeah.
And one should not.
What type of cancer?
I had breast cancer, sir, right
Breast
side.
cancer. Okay.
Yes, I had a lump which was removed, and rest of the breast is intact.
Okay.
And today only I took a free session of Sujok with the oncology ward patients in the command hospital, army hospital here, where I am. So it's a really amazing science which we read and follow and practice. So one more thing I would like to add here, sir, is other than the buttermilk and the fruits you said, pomegranate and combination of pomegranate, carrots and beetroot.
Yeah.
That juice really helped me regain my appetite.
Yeah.
So from time to time, and it helped in avoiding ulcers in the mouth, which normally happens as a side effect.
Yeah.
So, and the other thing which helped me was tripla. There is a dish. There is a
Tripla
dish.
is a wonderful drug. Tripla is an excellent drug that will always help you for any kind of a disease. Any kind of.
So in Himachal, I'm from Himachal.
Okay.
So in Himachal, we make a dish out of tripla combined with rice. So it becomes very tasty. It's good for everybody to make the system alkaline. So my mother-in-law used to prepare this for me, and it really helped me soothe my whole throat and, really helped me eat well. Plus ginger chutneys. I was very fond of chutneys, so I could eat almost everything during the treatment, but everything was cooked. Even the juices were cooked because they didn't want to take chance with any, infections. I was
will not
kept.
happen. See, infection will not happen. It is only the digestion. You are breathing so many. They mean to say you are getting infected. It's not that. So it is not that. But you should not overcook it. Even if you cook it.
It was just warmed.
Yeah, for warmed or steam it. That is better. And one
Yes.
more thing, one more fruit I would suggest is grapes. Grapes or wine. Red wine. Red wine is good. And one more fruit is sitafal. Any multiple fruit. Multiple, they are all like cancer cells. No? That is the one which indicates grapes. If you see multiple fruits, sitafal is a multiple fruit. So these things will really help. And for you, you can take a lot of avocado. Take
Okay,
avocado.
here in this part of the country where I am, Punjab, Haryana, avocados are not to be found so easily.
Yeah,
But yes, you can.
butterfruit.
Sir, what about dragon fruit?
Dragon fruit, I don't have any.
Because they suggest dragon fruit also during cancer, because it gives more blood.
See, for cancer, the fruits or whatever this thing you have, see whether it has got lot of antioxidant property. Should be an antioxidant. The cancer cells are formed mainly because the free radical, which really attacks. Free radical only attacks. So that is why any fruit that has got antioxidant property, you can have.
So I had kiwi as well, which
Kiwi is
has
also good. Kiwi is also.
yes. And the other thing which you mentioned that you go spiritual, that also helps a lot.
Yes,
know,
yes, yes.
And
Spiritual only is the ultimate.
the
The
other thing which
ultimate.
you said was be selfish for yourself. So even my doctor said so that you should put yourself first, and then you will be able to handle everything in life. So that's what I'm doing after my treatment got over, and I'm trying to
Good.
spread smiles. I'm following a Buddhist philosophy called Nichiren Buddhism. So that's also keep me going. It
Yeah.
keeps me going. Yeah.
Yeah, because once why we say self, actually you take water, sea water in a cup, sea water in a bucket, sea water in a tumbler, all are sea water only. Okay. You put it back in the sea. Can you identify which is the bucket water or tumbler water or the can't? But so we are all from the same spirit in different containers. We are in different. So you and I are not different. We are one and the same. So when you start loving me, I will start loving you also. That is how it is, because there is no difference. We are all come here for a purpose, and all of us have to die one. Don't worry about what is happening, this, that. I mean, it is not like a train journey. Some people get down in some place, some people get in, get out. It is the journey. Our life journey is like that. So there is nothing to be serious about. Just take it as it comes. What I always call it as situationship. Situationship. It's not from this situation. This particular situation. Okay, we react. That's all. Otherwise, nobody really says, "Oh, I love you." Nobody loves. It's all false. It's all false. So you just love God, and God loves you because He's the only person, or what do you call it, to love you. Nobody else. That is the truth. It is the truth in the universe. Don't worry. So love. So He will definitely he has to love you back. And whatever He does is right, because we are undergoing all these things because of our karma. Because of our karma only it is happening. It has, whether you like it or not, this will happen. Better accept it. Don't expect it. Then your life is smooth. Then you are always kicking and smiling. That's all.
Yes.
Yes. Okay.
One thing I learned in this course of treatment was that this word cancer is nothing to be scared about.
Yeah.
It itself says that you can, sir. So there are two words hidden in it, can and sir. So you can repeat it.
That is a good
That's
one.
what it says.
Yeah.
And the other one is that you have to live inside this body. So you have to take care of it. This is where you live in.
Yeah.
So
Like how you are taking care of your house. So you have to take care of your body. That is all.
this is our first responsibility.
Right. Good.
Thank you very much, sir.
Very well. Very nice. Very nice hearing to you. So encouraging. It's excellent. All of us should follow whatever she said. It is good. It is good. I'm very happy that the interaction was very good.
Thank you, sir.
Thank you.
Much humbled. Thank you.
Thank you.
And many have been passing their blessings and wishes for well-being for everyone. So I thank one and all who are supporting, not only through blessings, but with their care. So thank you so much. And any more doubts? I request you to raise your hands, please. anything, even if you want to say something, please raise your hands. I think your words could help someone. Your words could,
Soothe,
your
soothe.
blessing, yeah, bring blessing to people. And don't know, it's not like only cancer patients, but there are so many people who might be needing to hear you out. So I just request you all to please speak up. And thank you, sir. Ravindranatha sir, can you please switch on your video? Thank you, sir.
Madam, good evening. Actually, only my request. Actually, today I heard full his video. So many tips and so many advice Raghavan given. Only my one request is this one, because so many fellows might have not attended today's meeting. Can you put at least this alone? Can you put for recording in our group, so that we are all suppose some of the points I have noted down. No only so many points he has given like that. Similarly, others also it may help. Please, can you put recording this alone?
Sure, sir, we'll do it. And Raghavan sir, please repeat the points for everyone once again. Thank you, sir.
Repeat which point?
All the points which you have told, which could help cancer patients.
Points, what is it? I just talked.
No,
You
yes,
told about
Like,
SP6,
suggesting
SP9.
SP6, sir.
Yes, sir. SP6, SP9 also you told. GB
No,
39.
SP6, SP6 and GB39. SP, that is, if you keep SP6, suppose this is your leg, consider this as leg. Okay, then you keep SP6 here, opposite side. On the opposite, you will get the GB39. You will get it as GB39 on the opposite. So it will become GB39. So both the points will be paining. Give treatment over there. Okay, just give that or put
The
even a tape, put some pepper, put a tape, press it. So that is very useful. Why SP6? SP6 is spleen. Why we are talking about spleen? That is where it takes care of your blood. Why blood? Blood is the one which is circulated. You will suppose you say the cancer cell are spreading. Where it will go? How can it move? It can't walk. It goes through the blood, right? So, and the GB39 is the one where bone marrow, from where blood cells are created. So these two things, the new cells which are being born, they will be what do you call normalized. They will be balanced. So that will help. That is the main thing. What I am thinking of, that is one of the things you can try. But main thing is the food and your mental status. You feel happy, the entire system changes. The entire system gets normalized. But you should feel happy. You should not cry. You should not, I got cancer. Nothing to worry about. Nothing to worry. I've seen people living, identified cancer 30 years back, still there. Okay. No, nobody can tell you, oh, you have got cancer. You will die in 2 months. You will die in 5 months. Nothing. Don't worry. Don't. But it has been so dreaded. This is once you get cancer, that is all. End of the story. Nothing like it. Nothing. That is the only disease somebody had mentioned. Only disease which can be cured completely. Which can be cured completely. So there is nothing to worry about. Okay.
Okay, thank you, sir.
Yeah, welcome.
Jogi ma'am.
Namaste, sir.
Namaste.
Yeah.
Can you show your face?
Actually, I'm using. Okay. Yeah, I have a question about the about the bleeding after the delivery. Delivery of the baby. So my daughter-in-law, she delivered a baby girl on 1st of January, but now still she's having the bleeding is still going on. So is there anything we can do to, so that she doesn't get any weakness?
But bleeding man is continuously, it is a continuous process, or it is coming on
Yeah,
and off.
yeah.
It is every day.
Sometimes it's like, so yeah, sometimes it's like clots. So now
Okay.
the 40 days are gone, they are, so still she is bleeding. So I just want to know if anything we can do.
What we can do, because it is, you have to check. If the bleeding is
Okay.
there continuously, you have to see whether there is any problem with the uterus. Okay.
Um,
What
okay.
have they done any pap smear and this one? Whether anything has been done after that? Did you go and
No,
consult?
the doctor said, the uterus is normal now, normal in size, but they said they will do ultrasound later on. But I just want to know if we can,
No, better
do something.
consult. Because sitting here, no, we don't know what is happening.
Okay.
So
Okay.
we cannot
And
say.
okay.
So you have to consult a good gynecologist. See, and let them make an ultrasound or whatever it is. If the bleeding is continuous, that means there is some problem.
Okay.
There is some problem. Or is there any injury inside? We don't know, which is not healing. So all those things we don't know. So what is the status of the weather? From where it is coming? Is it from the vagina or is it from the uterus? Or anywhere? We don't. So you have to just check.
Okay.
That is thorough study has to be done.
Okay.
And she might be weak also, and please check her BP and everything also.
Okay.
Yeah.
And one question, about the cholesterol. Is there any relationship with the cholesterol and the vitamin D, B12?
Yeah, B12. See, everything relates to antioxidants. If you have less of B12, your antioxidant production will come down.
Okay.
Antioxidant, because that is the one which converts methionine into cysteine, from cysteine to glutathione and other things. So vitamin B12 deficiency leads to less of antioxidant production in your system. Okay. And of course, vitamin D also. So you have to, you have to see to that you take a lot of vitamin B12 and other things. That has to be looked into. And with a lot of fruits and other things, you will get. Banana is very good for vitamin B12. You take a lot of banana, they're good. And of course, apple and all these foods we were telling, fruits. Take a lot of fruits. They take this pounded rice or brown rice. So that will have a lot of vitamin B12. You have to take that. But as I told you, carbohydrate in less quantity and roughage in more. Sprouts.
Yeah.
And think of sprouts. Sprouts are very good. You can take that. Go for anything which is green. Go for green. Green. Yeah.
But sometimes, it makes like burping, and there's so many, maybe digestion is not good. So
then burping is there. Then take a little bit of pepper, hinge, this one, what do you call ginger, all those things you can take. They are digestive. Take more of that. Then the this thing burping will not be. It won't. It has, because a lot of roughage. It really helps in motion, and it also helps in the cleaning up. It is like something you brush your teeth, no, to clean up. I guess it will brush your intestine. Roughage is very good, so it will clean up your intestinal health. Will be very good.
So what about fennel seed?
Which one?
Fennel seed.
Fennel
So-
seeds, yeah, you can have that.
Mhm.
You can have fennel seeds. You can have. You can have walnuts. You can have pumpkin seeds. You can have. All of them they
Which one?
contain lot of pumpkin seeds.
Pumpkin
All of them
seeds.
they
Okay.
yeah. So all of them they have a lot of what do you call that? Omega-3 fatty acids. They're all helpful in they're all helpful in building up your immunity.
Okay, I will. I am taking fennel seeds and pumpkin seeds. So, but I will check.
Flax
I will
seeds.
more
Also.
vitamin.
Flax seeds also.
Flax seeds. Okay.
Yeah, flax.
So flax seed we can take like raw, or we have to
Raw. Just after
raw.
food, just take a little
Okay.
bit of go on munch.
Okay. Okay.
Okay.
Okay, I will do that, and then I will let you know what about my
Yeah.
cholesterol.
And Kiranji also.
Okay. Thank you.
Okay. Welcome.
Thank you, everyone, sir.
Yes.
Tomorrow.
Tomorrow, I don't know what topic to speak. Can suggest something.
Anything
able
related to heart, sir? Because now we have so many heart attacks and all these conditions after.
Tomorrow again, this not spiritual.
No, heart connected to spirituality.
Sir, let's ask the participants. Let them come out with
Yeah,
the.
you also can come and give your suggestions, please. Anyone?
Anyone? Something on spirituality. Today we talked about our body. Let us talk about our mind.
Yeah, whatever you take it, sir.
I
Good
think.
evening, sir.
Hemalata.
Good evening, sir.
Yeah, good evening.
Can we discuss religion and spirituality tomorrow? If it is okay by everyone.
No. Any topic we can speak. Religion and spirituality. Why there is religion? Why it is spiritual? You want to act accurately?
Religion and spirituality. Some are religious, some are spiritual. So
yeah,
the difference.
Okay, right. Okay, good topic. We will talk about it. We'll talk about.
If everyone agrees.
I
I request you to take a prostrate health as well.
Huh?
I request you to take a prostrate health and issues.
What health?
Prostrate.
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 Yeah, and
Prostrate
someone wants
Yes, sir.
autism and speech language delay, intellectual disability in kids also, sir. So I think next Saturday we can look into it. If you
Next Saturday, because I believe Joshi sir wants me to start a fresh batch
yes, sir.
of Akupepper.
Yeah.
That we can talk. So tomorrow we will talk about religion and spirituality.
Yes, sir. Okay.
Tomorrow, that is a nice topic which I want to ponder about. We have not talked about it. Anyway.
Thank
I
you.
would like to talk more on spirituality rather than on health.
There was one doubt from Hemalata, ma'am. If you can answer her, sir.
Yeah. Yes.
Namaste, sir.
Namaste.
And really, I'm not asking anything about spirituality. I have a personal problem of my health. Can I ask you, sir?
Why don't you come in the group? You can ask the question. No? Because this one will be, if you have anything personal, you can. Is it related to cancer?
No, not at all.
No, then forget about it. Then you can ask that question in the group by answering the questions.
Are you in the group, ma'am?
Yeah, I am in the group.
Then please go through the questionnaire of sirs and please complete it, and you'll get the answer in the group itself.
Oh, okay. I'm sorry. Okay.
No
Okay.
problem at all.
No
Thank you
problem.
so much.
Thank you.
Okay. Right.
Right, sir. Thank
Sir.
you so much. Does
Sir.
anybody have questions still?
Thank you, sir.
Who is that?
Sir, probably next week we will be having, we will start a fresh Kipepper session, sir,
Yeah.
from 24th, 10 consecutive sessions.
Yeah.
So from next week, 24th, that is Saturday, 7:30 p.m. Please attend continuously. Your attendance will be recorded, and please share this videos, like a link to everyone, so that all of your friends and family too can join and understand what is acupuncture therapy properly, because this is a second session again, and I don't know when you'll be getting another opportunity like this. So I request each and every one of you to please join the link, and please share your inputs in the group also. And whatever personal questions you have, you please ask in the group. All right. And whatever doubts related to the subject, you please ask here. You're open.
Okay.
Okay, sir. Thank you so much.
Right.
For
Welcome.
this
Thank you.
great evening, sir, helping so many individually also. So
Actually, very, actually, I even enjoyed today's session. A lot of good feedback. Okay. Especially from Sood. It was very good. Thank you, Sood. Thank you
yes,
so
sir.
much. Okay.
Thank you
Thank you,
so
sir.
much for your inputs, and thank you so much, participants, for your blessings. And let us always keep praying for the well-being of everyone, whoever it is. Let everyone be happy, healthy, and safe in the
Sarvajana Sukhino Bhavantu.
yeah, Sarve Jana Sukhino Bhavantu. So thank you so much, and have a great weekend. Let us everyone meet tomorrow 11 a.m. and please keep sharing the links so that so many of us can join and enjoy these sessions. And please be interactive here also in the session, and also after the session in the groups, so that we would know how it is going. Okay. So thank you so much.
Okay. Okay.
That's
Thank you.
sir, from Joshi's Kerala group.
Thank you.
Thank you so
Bye.
much for helping us learn ourselves and living in a better way, and in a making up a better lifestyle for ourselves.
Thank you. Thank you.
Thank you so much, sir. Have a great
Thank
evening,
you.
everyone.
Thank you.
Thank you, sir.
Bye, everyone. Let us meet tomorrow morning, 11 a.m. sharp. Please join in, and thank you for today's attendance. Please check your groups for your attendance. Thank you so much. Take care, everyone.
Thank you, sir.
Good
Thank
night.
you.
Bye.
Thank you, sir.
ma'am.
In this session.
Thank you, ma'am.